Thank you. So this is the dreaded first session after lunch that I now have to try to keep everybody awake for, now that you've had all of that food from upstairs. So I will do my best. And I know that my title slide does not exactly match the title that is in the conference brochure, but I absolutely love this picture. And the caption that was up there, it feels so fitting. And I promise it is the same presentation as was described, because in many ways what we're going to talk about is understanding capacity for care so that you understand what it is, what we mean by that, and then what that means for you practically. So what do you do with that? What do you do with a big abstract concept like that that can improve your operations, that can improve the care that you're able to provide to the animals and make things better? And two of the big pieces that we'll talk about with that are utilizing daily rounds and thinking about overall population management. So this all goes together. And who can resist cats getting a massage? Okay. So because it is after lunch, and because it's just nicer this way, I am going to try to get you to answer a few questions for me along the way. So the first one, I'm hoping just by show of hands, how many of you are with an organization that has a physical brick and mortar shelter? Okay, almost everybody in the room. How many of you are with an organization that is exclusively or primarily foster home based? Okay, a couple. So I'm guessing there might have been some self-selection in who came to this talk. We are going to talk a lot about shelter-centered strategies in terms of leveraging capacity for care or staying within your capacity for care. But all of this is relevant no matter what type of organization you have, what your physical structure is, what your mission or your resources are. But I'm hoping to kick us off that a couple of you might just shout out what some of your goals or the mission, and I don't need the whole actual mission and vision statement, even if any of you have that memorized. But what does your organization strive to do? What are you really aiming your efforts at?
For us, it is saving as many animals as we can, but keeping in mind the welfare and quality of life for the animals that we have. That's my concern as a director.
Great. So saving as many animals as possible, but really keeping their health and welfare and well-being at front of mind and trying to do that. Excellent. I heard somebody else in the back. Education. Sure. So lots of different programs, TNR, adoption, fostering. And I know there's a lot of overlap in what we all do. Anybody else have anything they want to shout out?
We want to provide that quality of care in a way that's also healthy for our staff.
Great. That's an excellent point. So making sure that we are cognizant not just of the well-being of the animals, but also of the staff that we have and the volunteers that we have who are providing the care for those animals. Excellent. So many of us, somewhere in our goals or our mission, have a number, or maybe even all of these, in the list of things that we want to accomplish. We want to improve animal welfare. We want to save as many animals as possible. We want to prevent suffering. We want to, on a bigger picture scale, reduce overpopulation, reduce euthanasia, or some combination of the above. And for some organizations, it's all of those. For some, it is a target on one of those individually, or one or two of those more so than others. Regardless of where you fit in here or the information that you just shared previously, the reality is that what we're going to talk about today, especially when we talk about effective population management, impacts you, because it's going to help you meet your goals. It's going to facilitate your ability to get to your mission and to do what you're really trying to do as an organization. This will help you reduce length of stay, and we'll talk a lot about reducing length of stay as a strategy for staying within capacity for care. Improving animal health and welfare, that's certainly at the top of almost everybody's list in this field. Being better able to meet the animal's needs, and allowing us to redirect our resources. So this is probably not one that most of us would think of at the top of our list or think of as a primary goal, but it really is a means to an end. And it is something that is very beneficial because it allows us to then redirect resources, redouble our efforts to expand what we're able to do in terms of helping animals, helping people. So we're going to talk a lot about population management, and I wanted to start off by just framing what is population management. And so when we use that phrase, what we're really describing is an active process. So this is something that there's intentionality behind. This isn't happening passively or by happenstance, but it's an active process that requires planning, ongoing daily evaluation, and response to changing conditions as the organization cares for the animals. So this is something that we want to be active participants in and really helping direct what we're setting ourselves up to manage and how we're caring for the animals, and not that it feels like everything is out of our control. Because the reality is that, there are some things out of our control. There's, surprise, here's a hoarding case today, or, surprise, 3 people called out sick. Like, there are always going to be some things that are out of our control, but bigger picture things in terms of understanding, planning, setting a path and devoting resources, having that something that is actively managed makes all of those other little surprises much, much less disruptive than they otherwise would be. So again, you'll see the words plan, you'll see intentionally in there. And this is really thinking about how are we managing their stay from the time they come in to the time that they leave? How can we make that as short as possible? And how are we doing this in a way that provides for that individual animal's needs and that we can ensure the needs of all of the animals in the entire population that we're caring for? Because the other end of the spectrum of not operating within our capacity for care and not paying attention to that are the really, certainly it's a spectrum, and this is really the other end of the spectrum, the very extreme example, but thinking about animal suffering or loss of life, wasted or misused resources, certainly staff and volunteer frustration or burnout, even criminal charges. This is just a screenshot of an article from a very large rescue hoarder case in Hoke County, North Carolina. That was in early 2016. You can see more than 600 animals. And certainly this is an extreme that is not the reality for most organizations, fortunately. But it's a spectrum from what we want to have all the way to the other end. And we want to keep ourselves on the highest end of that spectrum as possible and continually improving. So how many of you would say that you have a plan for active population management? Okay, so I see some, kind of like, not really. I really want to be able to say that I do and I don't. And you know what? That's okay. I think that one of the things that is a reality for everybody in animal welfare and sheltering is that we're always striving to improve, right? No matter how good of a job that we're doing, there's always more that we want to do and that we want to achieve and that we want to improve. And continuing along that pathway is really important. So if you don't have everything in place, that's okay. Rome wasn't built in a day. You don't have to have a huge system in place or a plan to do it by the end of these 2 talks today, but starting to put those pieces in to create a really positive cycle is a huge step. And just sitting and thinking about this with us this afternoon is a great way to get yourself along that pathway. So when we think about trying to generally maintain a good standard of care, maintain animal health, maintain animal well-being for the animals in our care, we think about how we're going to manage the population. What strategies do you have? What tools in your toolbox do you feel like you have right now that you utilize? So as an example, managed intake or special adoption promotions for animals who have been there for a certain period of time or maybe have certain physical or behavioral characteristics. Who has strategies that you feel like are helpful that you want to just shout out? I'm gonna start in the front and work back, just in the interest of not losing people. Managed intake.
Holiday specials.
Okay, holiday specials.
Over a certain age.
Over
8 years old, they're free or reduced.
Okay, so differential adoption pricing for animals over a certain age. Foster programs. Excellent. Sorry, say that again. Special needs adoptions. Okay, so communicating with staff so that everybody really understands the needs of the animals, both so that we can provide care and then that we can find them placement. Daily rounds, yay. Socialization. Anything else anybody wants to? Transport programs.
Working cat program.
Working cat program, so like a barn cat program. I like working cat. Anybody else? Excellent. So the reality is there's no one tool that's going to work in every situation or that's going to work for every organization or every animal, right? We have a whole collection of strategies that we want to employ. And hopefully by the end of this talk and the follow-up talk after this, we'll have a couple more tools for you to utilize. So two big things that we think about with population management are being able to provide care for all of the animals in your facility and making space by decreasing time. So increasing the number of animals that you can care for by decreasing the amount of time that they spend with you. And so there's a couple of key points that we're going to talk about throughout this session and the next one. We're going to spend a fair bit of time talking about and understanding capacity for care. We'll talk about pathway planning, decision-making criteria, which really fits under pathway planning in many ways, and daily rounds, and then a couple of others as well, and we'll have some time for discussion. So again, when we think about many of the commonalities that we have, regardless of our facility or our resources or exactly all of the services that we provide, in many ways, pretty much every shelter wants to save as many animals as possible to really maximize their life-saving capacity, right? We do what we do because we want to improve animal lives, and we want to do that to the greatest extent and for as many as possible. I think it is a natural tendency to feel that this can be accomplished by housing more animals. And I say that recognizing that I have to mentally remind myself that isn't always the answer. That is often not the answer because it can really be counterproductive. And many of us struggle, if we're not actually unable to say no to just one more, it's almost physically painful to say no and say, no, we can't help right now because these are the resources that we have, these are the animals in our care, this is what we have to do for the good of the whole population. And this is because every organization has a maximum capacity for care. And it's really critical that the population that we are caring for does not exceed whatever that level is. And the most fundamental reason that that's true, and some of you may recognize a lot of these are statements from the ASV guidelines, and I put them in because I think they're very well said and they're also very succinct. But the underlying main foundational reason that capacity for care is so critical is because once we exceed our capacity for care, it's no longer possible to ensure the 5 freedoms, to ensure that animals have good health, good welfare while they're in our care. And that is really what we want to keep first and foremost in our minds. So everybody has at least heard of the 5 freedoms? Yes? Okay. Many of you, I'm sure, could recite them back to me without looking at this. But just as a quick reminder, the 5 freedoms are the freedom from hunger and thirst by ready access to fresh water and diet to maintain health and vigor. Freedom from discomfort by providing an appropriate environment, including shelter and a comfortable resting area. Freedom from pain, injury, and disease by prevention, hopefully, or rapid diagnosis and treatment. Freedom to express normal behaviors by providing sufficient space, proper facilities, and company of the animal's own kind. And freedom from fear and distress by ensuring conditions and treatment which avoid mental suffering. So some of these certainly are a bit more challenging to achieve for some or for even the majority of animals in a sheltering setting. That is not to say that one is more important than the other, and really thinking about all of these when we're carefully evaluating the animal's needs is critical, because it isn't just a question of are there enough people to feed everybody and get their cages cleaned, right? It's so much more than that. And the truth is, you can have too many cats. You can have too many dogs. I feel like cats are usually what falls into this. But the reality is there is a number that we don't want to exceed. And what that number is for your shelter or your shelter or your shelter is going to be different depending on your specific resources, on your facility, on your staff. It's also going to depend on the specific needs of the animals in your care. So when we think about kind of the inverse of capacity for care, we think about crowding or overcrowding. And this is just if you Google in overcrowd, and I actually prefer the term crowding. Overcrowding to me is like we've even gone a step too far. We don't want to be crowding. We really don't want to be overcrowding. But in terms of the way that we usually use the word, I just put the definition up for overcrowding, which I know we all know, but it is sort of the antithesis to capacity for care or operating within our capacity for care. And that is to fill the accommodations or space beyond what is usual or comfortable. And so I sort of keep those two opposite ends in mind and think about what we can do to keep that balance where we want it to be. Another way to think about crowding or to sort of think about the inverse is that when we have crowding, it's because we're maintaining a number of animals that are in excess of whatever our capacity for care is. And crowding is bad, right? Overcrowding, crowding, whichever word we use to describe that, operating beyond our capacity for care, that has a lot of really negative repercussions. It's an extremely potent stressor for all of the animals. So I don't know if any of you were in the DVM track earlier today. For Dr. Lockwood's first session this morning, we had a lot of people who really wanted to come see him talk, which is great. But we exceeded the room's capacity for care, and I'm sure the fire marshals would have had something to say about that had we had them in there. But we had people who could not fill the seats, so we had people who were sitting on the stairs because they really wanted to be there, and that was great. But you notice things, right? The clinking of everybody's lanyards gets a little bit noisier and a little bit more disruptive. The shuffling of paper, somebody crawling over to try to find a seat. Even the temperature in the room. Compared to something like here, where we still have some open space, people can spread out a little bit, we're within our capacity. And that may seem like a silly example, but I think just remembering what it feels like for us when we're in an uncomfortable, crowded situation gives a quick snapshot of all of those challenges that we see when we have a crowded shelter. Because it exacerbates all of those other challenges and all of those negative factors that we're already dealing with in a shelter setting. So we have a number of side effects of overcrowding. It's certainly easier to spread disease. You get a greater buildup of pathogens and germs in the environment. The noise levels go up. The air quality goes down. We generally, as crowding continues, see compromised animal care, and then in turn compromised customer service. The staff get overwhelmed. I know when I'm overwhelmed, I start making poor decisions. I don't think things through, or I don't think them through as clearly, and I'm like, no, I just, need to do this and move on. And, then in hindsight, you realize this is, probably not the way I should have handled it. And it's very stressful. That is very true for the animals, and it's very true for the staff. And that, in turn, can create a vicious cycle. So we get things like increased disease transmission, increased animal stress, increased staff stress, diminished welfare, decreased capacity for care, declining customer service, increased length of stay. And these don't just flow in one direction, right? They all play together and they all influence each other, and it sets up a really negative situation. So here's a working definition in terms of thinking about how to define and determine capacity for care for your organization. That is how many and which types or which kinds or which characteristics of animals that your organization is able to provide adequate care for at a level that meets their physical and their behavioral needs. This is the foundation that everything else that we talk about in sheltering rests on. It really, really is. So what factors, I've said a couple of them, but when you think about what this means for your organization, what are some factors that you would consider that would influence your capacity for care? Number of caregivers, excellent. So whether that's staff or volunteer, however many human person hours we have. Fosters, okay, so do we have outside networks that we can tap? I heard cage space. Do we have a physical enclosure for that animal? Financial resources for medical. The number of people adopting, so how many animals are leaving. Anything else that springs to mind?
Off-site adoption.
Off-site adoption, so other outlets that you might have available. Cage size, sure. Sure, so time-consuming medical issues, time-consuming behavioral issues. There's lots of different ones, and I'm not going to go through all of them. There's a couple of big ones that I'm going to pull out to talk about a little bit more, and what the relevant considerations are. There's some that are sort of universal to the organization. There are others that may be more specific to an individual organization, and that should make more sense as we go along. So there's two big ones that we always think about, and these are probably the easiest ones up front to think about, and that is housing capacity and staffing capacity, and then all of those other resources. So financial resources for medications, financial resources for veterinary care, whether that is to pay a veterinarian on staff and they have enough time to actually tend to the needs of the animals that are entrusted to their care, or that's sending them to a private veterinarian that you work with. Are you doing behavior modification? Are you doing training? Are you working with a lot of behaviorally challenging animals? The amount of resources that you will need to dedicate to those animals is going to be different than if you had a population of easy, well-socialized, well-mannered, perfect, little well-trained dogs that didn't need a lot of work. All different things. It will depend on the population that you serve. So this is Rupert. I'll tell you a story about Rupert in a couple of slides. Rupert was a foster dog of mine, and lovely dog. I love hounds. My husband, not such a fan. Wasn't a fan after the first hound, really wasn't a fan after the second hound. So we are down to just a pit bull right now. But Rupert was a lovely dog, and Rupert was meant to be a short-term easy, and I felt guilty about this at the time because we all have that weird guilt thing about easy animals. Easy, temporary foster, and Rupert turned out to have major unusual medical issues, and also turned out to have extremely severe separation anxiety, storm phobia, thunder phobia. He had a lot of issues. So this was Rupert. This was the first time that we left Rupert alone. It's probably a little hard to see. So this is all stuffing that used to be inside this chair. And here's our other dog hiding behind Rupert saying, that was not me. So I've fostered multiple dogs at a time before. We had one dog, we used to foster other dogs routinely. Sometimes we had 2 dogs, sometimes we had 3 dogs, we'd have litters of kittens, and it was fine. That was within my capacity for care. And then we had Rupert. So he's still one dog, right? But not every animal is created equal in terms of the needs that they put on your staff or on your organization or your outside resources, right? So what it took to manage Rupert to meet his medical and behavioral needs, there was no question. We actually had a third foster dog at the time, and she was easy. She'd recovered from pneumonia, and she was lovely. She was just sort of hanging out with us until she got adopted. So she went to somebody who could manage her, and we kept the challenging guy. I do not have the clicker anymore. I believe our room monitor has it, and I suspect he went to get batteries. That's okay. So he was so much more labor intense. And if you have 5 Ruperts in your shelter, they may require an entire staff person who otherwise maybe could care for 10 or maybe care for 15 dogs. So it's not just about the number, it's about the specific animals. And we all have our own individual capacity for care, right? Like what our capacity is in our homes, in our personal lives for humans or animals that you may be entrusted to care, it's the same thing for organizations. So we'll talk about housing capacity, we'll talk about staffing capacity, and then I'll give you some examples of how you can estimate when you think about what those other critical additional resources are so that you can start to think about the needs for your organization. So housing capacity. Staying within housing capacity means that you have an appropriate enclosure for each animal. And I'll define housing capacity really, really loosely. I'm talking about it here, obviously, in the context of a physical enclosure in a shelter. But if you think of capacity in foster, for example, a foster home has a specific capacity. That may be 1 litter of kittens, that may be 2 litters of kittens, depending on that specific volunteer and on their home. But you want to make sure that the environment, whatever the primary enclosure is, if that's somebody's spare bedroom in their house or it's a cage in the shelter, that is appropriate. And a couple of things that dictate it being appropriate is we want to make sure that it's in an area that makes sense, so we're appropriately segregating by species. That includes prey-predator status, so cockatiel over here, cat over here. Who's enjoying this situation? It's great. It's probably great enrichment for the cat, right? Not so humane for the cockatiel there. Thinking about separation by age, thinking about health status, gender, behavior. And then certainly we want to make sure that it's an enclosure that's an appropriate size. And it's hard to give actual physical dimensions, right? Even if you go and you pull out the ASB guidelines, we're a little bit more specific around cats, just because cats generally, with not a whole lot of variation, fall into roughly the same size. Way more variability in dogs if you think about what a Great Dane would need compared to a Chihuahua. But I think this is actually one of the most helpful rules of thumb, is that you don't have to remember a number. You can eyeball it, because you just need to look and make sure that that animal has an enclosure that's sufficient to allow for normal postural adjustments and to maximize the functional separation of space. So they can turn up, they can stand easily, they're not, all squished into something small and can't do that. They can sit, they can stretch, they can extend their limbs. They can do this without their ears hitting the top of the cage, for example, or their tail not touching the back of it. And they're able to posture comfortably to eat, drink, urinate, and defecate. So the other thing to think about is, we talked about the characteristics of where that enclosure should be, of what the size that it should be, but it also depends a bit on that animal, right? On their behavior, on their health. It also depends on how long they have been with you if they're in the shelter. Because as the animal's needs change, especially as they stay with us for longer periods of time, things like an enriched environment and positive stimulation, which are always important, become that much more important and critical in terms of maintaining welfare. And really being able to provide alternatives to traditional housing for longer lengths of stay is really important. Okay, staffing capacity. So I think, because cats have staff, right? The reality is we need staff, whether that's paid staff, whether that's the wonderful volunteers, or a combination of the two. We need people to care for the animals. And I think that the way that many people's brains work is the first question, and sometimes the only question about do we have capacity, is do we have an open enclosure? If we have an open cage, we can take them in. If we don't, we can't. Sometimes that means we'll set something up temporarily, which really means that you're going over capacity. But the other thing that is really critical, and I would say is the rate limiting factor for most organizations, is do you have sufficient staff to meet those animals' needs? Did you have a question?
Yeah, I don't know if we'll touch on it.
Yeah, so the question was, what if you have free roaming rooms, in terms of what that looks like? And there are guidelines in terms of density, how much space, how many resources that they want to have. So it still would require the same general considerations that we talk about, whether it's an individual enclosure for one, or we're talking about co-housing or group housing. One of the things that may change is what your staffing capacity is required to care for those cats, for cleaning, for example, probably not for socialization. So it will depend on how you're managing your population and who you have. Does that help? Okay. Okay, so we can estimate basic staffing capacity. Many of you have probably seen this formula or heard this recommendation, which comes out of NACA and also HSUS, and it's the recommendation that's repeated in the ASV guidelines. And that is 15 minutes of staff or reliable, like you can count on them, they're going to be there on a regular basis, volunteer hours for cleaning and feeding of the animals. This may change, right? If you have a really laborious cleaning process, if you don't have double-sided enclosures, you have to remove every dog individually, clean their enclosure, then go and put them back in, that may be too short. I know shelters that realistically, it's 20 minutes or it's 25 minutes per animal that they need just for basic care because of the constraints of their SOPs, of their facility. So this is really recommended as the minimum, and if you know that you have challenges like that, you would really want to estimate this up or round this up to what is true for your facility so that you're giving yourself a real estimate. But this will give you a rough idea just for that basic care of how much staff time you need for the number of animals in your care. Or conversely, if you know that you have a certain amount of staff time, you can then back calculate what that would support in terms of an animal population. And so you can see, we'll come back to where length of stay plays into this, but if you have, and this makes inherent sense, right? If you have 25 animals in the facility, this works out to be 1.5 people to get all of that cleaning and feeding done in 4 hours. If you double the number of animals that you have in the facility, it's going to take double the time to care for them, and so on and so forth. And it seems like a very, very simple exercise to actually calculate out how many hours that you need, but it's really, I think, very much worth the couple of minutes that it will take you with your iPhone and see how that matches up with your shelter population. The other thing that you want to think about is figure out what services, when we're thinking about staffing capacity, that you know you're going to need to provide, either to every animal or to certain animals, whether that's a medical or a behavioral evaluation, maybe it's time for adoption counseling, maybe it's spay-neuter surgery or euthanasia. You can estimate how many staff in different positions you will need to meet those needs based on what an average time for service is. So here's an example. If you say our average intake exam, every animal comes in, they get an initial exam, they get their vaccines, that typically takes 10 minutes. And you take in about 10 animals a day on average, you know up front you need 100 minutes of staff time. You need almost 2 hours of somebody's staff time, whether that's all of their job or part of their job, just to get that done. And that's average, right? So sometimes it's a little less, sometimes it's a little more, but it can be really helpful in terms of thinking out what are staff assigned to and where are we light or maybe overstaffed in certain areas. How many of you have seen a graph that looks like this, that shows you the bars of the shelter population against the number of staff that are available or the hours of staff that are available? Does this look familiar to anybody? Okay, so a couple of you. So basically there's a lot of color, there's a lot going on here. But what this is showing you going across the bottom is by month. So January on your left, December all the way over here on the right. And it's going month by month. This was a shelter that has different sources of intake. So they have stray animals that come in. They have owner-surrendered animals. They do law enforcement. So they have some that are seized as part of cruelty investigations. And then they also do rabies observation holds for the local Department of Health. And all of those have different required lengths of stay. So this was looking at their different populations. And you can see that they average somewhere between just under 40, this is probably about 37 at the quietest time of year, to about 55 in the summer, dogs in their shelter. And then they calculated out how many staff hours would that take to care for them, which is this green line that goes along the top. And you can see that that matches exactly how many animals are in the facility, because that's a determinant of it. So that ranges somewhere between about a low of 9 hours to a high of, say, 13. And then this line on the bottom is how many they actually have. So even without me reading numbers, you can see that this is a huge discrepancy here, right? And without telling you anything else about this organization, we can start to have some idea of what challenges are that they may face, of what the amount of time and the level of care that they're able to provide for each individual animal. And clearly there's a discrepancy here that needs to be rectified by bringing these two lines closer together so that we have staff that balances out with the population that we're caring for. So going back to that earlier question at the beginning of what are your goals, what are your mission, one of the common things that we're all trying to do are to save as many animals as possible. There are a lot of different things that influence that, but there are two big ones that we think about that play a key role. One is how many animals can your organization care for at any given time? And then how long do they stay with you? And those sound very simple and like almost too basic to explain it all, but they are two really critical features. The other one that is related to this is thinking about what your average shelter population is. So how many animals do you actually have with you at any given time? And that has two main determinants. One is how many walk in the door, and the other is how long they stay with you. And so I point those things out because I think that's actually very powerful, thinking about where we can target efforts in terms of ensuring that we are staying within our capacity for care. So we have two shelters here as an example. We have shelter A. They have space for 100 cats appropriately for 100 cats. They have an average length of stay of 3 months. And then we have shelter B, which has space for 35 cats and an average length of stay for 1 month. So which shelter would you rather and why? B. Okay, so I'm hearing lots of Bs. Anybody want to tell me why you would rather B? Okay, so, and that is exactly true. So over a period of time, if we look over a year, for example, this shelter will actually be able to care for more animals despite caring for fewer at any given time because they have a shorter length of stay. Length of stay is such a critical feature. And that seems almost counterintuitive at first glance. Well, you think shelter A has capacity for almost 3 times as many animals, but because they're staying so much longer, that is negated. And when we get into a situation where these numbers reflect not a difference in capacity, but a difference in what they're actually doing, then really we want to be shelter B, because not only are we able to help more animals at the end of it, but we're also able to do it in a way that is much healthier for them, much more humane for the animals and for the staff who are involved in their care. So looking at this another way, how many of you have seen the length of stay game that's up on ASPCA Pro? Okay, a couple of you. So I hate trying to show videos and presentations because I am not, tech work is not something you learn in vet school, and I feel like it invariably goes wrong. So I have my low budget animation to try to show you the same principle, but I did include the link in the slides, and if you haven't actually seen the video clip, it's about 4.5 minutes. It's really worthwhile watching. So we're going to do this on an artificial timeline because we want to be able to show it relatively quickly. So we have shelter A. They take in an animal every 30 seconds. They have 5 enclosures. They have an outcome every 2 minutes. And then we have shelter B, which also takes in an animal every 30 seconds. They have the same 5 enclosures, but they have an outcome every minute. So let's start off. And the reality is no shelter starts empty, right? I feel like even at some point, I suppose there was a shelter that was built that had no prior population of animals going into it. But the reality is even when you start with a new shelter, you're bringing over animals from somewhere, right? Okay, so here's reality. We'll assume that both shelters have animals in them to start with, and they are not completely at capacity. So we start at time 0, and here comes 30 seconds, and we get new intakes to both because they're each taking them in at 30 seconds. But we get an adoption at 30 seconds, or we get a return to owner or return to field, or whatever that outcome is, from shelter B. So, okay, shelter A is at capacity. Shelter B has a little bit of wiggle room. Let's go another 30 seconds. We have another outcome. Shelter B gets another placement, and now, because we've hit a minute, I promise the math works on this, shelter A has also had an outcome, but they both get their new intakes. And so we'll go another 30 seconds and another 30 seconds. And you can see that what happens is as the animals are leaving, new animals are coming in, and we are ending up with a situation because of the difference. Nothing else is changing. Nothing's changing with intake. Nothing is changing with the number of housing enclosures. Because of the length of stay and because shelter A's intake outpaces their rate of outcomes, you can see that they're starting to fill up. And they are clearly over capacity now that they are starting to double up enclosures. So going back to that same example, I had actually done out the math. And I had called them shelter A and B before, and now they're shelter X and Y. But same idea. So 400 animals or 420 animals a year. And the reality is that when we are efficient, we can often help more despite housing fewer at the same time. So length of stay is a huge thing. And a lot of the tools that we're going to talk about in terms of making this practical and useful for your facility center around reducing length of stay. And that's for a number of reasons. One is that limiting length of stay allows you to limit your daily shelter population without changing anything about your intake, and you want to limit that to a reasonable level. So what's reasonable? That's going to depend on a couple of things. It's going to depend on your facility. Do you have a tiny house or a great big mansion? It's going to depend on your staffing. Do you have maid staff, or are you trying to train your cat to clean the mud up off of your couch? It's going to make a big difference. What do you have in terms of financial resources that are available? Do you have the real crown? Do you have the Burger King crown? So it's going to be different for different facilities. But the reality, again, crowding is not inevitable. We can plan that we are operating within our capacity for care. So when we have those surprises, we can sort of roll with the punches and accommodate those, and they don't become catastrophic in the way that they can be when we're really teetering on the edge. This is just another way to show you that, and the more animals that you take in a year, the more profound this effect becomes. It's the same math, nothing actually changes, but if you're taking in 100 animals a day or 150 animals a day, and they stay for an extra day or two, what that ends up meaning in terms of how many animals are in your building is just way more animals than if you're taking in 10 or 12. So these are the same increases in holding. This is how long they're being held for. So the first bar on the bottom is minimum legal holding, which in this example was 3 days, and then adding extra days to that. So adding another day, adding 3, adding 5, 7, or 10. And then the different lines are based on a hypothetical intake. So down here, and part of this is, obviously it's the x-axis, y-axis, sorry. It's been a long time since I've had to do real math. It doesn't show the changes as well for the smaller intakes. But you can see down here, this shelter has 1,000 animals that it takes in every year. And there is definitely an increase, and it's going to be a substantial increase for that organization in how many animals they would have in the building depending on how long they stay. But look how big of a difference it gets. Let's take these two. 10,000 intake. If they just held for that 3 days, they would have a little under 100 animals. If they double that, they have 150. If they add just a week to that, they have almost 300. And when you go up to the really large organizations that take in tens of thousands of animals every year, this can push you from a big population of a few hundred up to something really much larger than that and closer to 1,000. And this is just showing something similar in a slightly different way. So the reality is longer lengths of stay without addressing anything else will lead to a higher population density in the shelter. And this matters for a bunch of reasons. So there's real health implications to animals staying longer in the shelter. We know that high density populations are at greatest risk of infectious disease. So you think about canine infectious respiratory disease. It got the moniker kennel cough for a reason. There's a reason kennel is in that name, because of the association with dogs that have a lot of contact with other dogs, and especially with high density housing. So just taking infectious respiratory disease as an example, these are just 2 studies looking at respiratory disease in shelter dogs. The first one found that the strongest prognostic factor, so the best way to explain, or what most explained coughing, and this was a vaccine study, so these were dogs that were vaccinated or not, but the thing that most explained it didn't actually have to do with whether or not they got a vaccine. It had to do with how many days they spent in the shelter. And every extra day in this shelter that they spent increased their risk of coughing by 3%. Another one, this was looking at influenza in a shelter, and they found that the only thing that was significantly associated with whether or not a dog showed a positive titer against influenza, meaning that it had been exposed to CIV, was the number of days that the dog had spent in the shelter. And so every 3 days that they spent in the shelter increased the odds of a positive test by more than 2-fold. And these are just 2 examples. There are many, many others. And this is something that you guys could have told me even if I didn't put these up on the slide, right? You know that it's a risk, and that's not a criticism of anybody. It is a reality. I have 2 little kids in daycare, and I cannot, for somebody who works with shelters and works with high density populations of mammals, I am still astounded by the frequency with which somebody comes home with something sick and then passes it to the other one and passes it to us and then goes back, and then they come home with something new. So there is a biologic reality to that we need to recognize. And there's certainly behavioral implications as well, right? We know that the stress induced even by short-term confinement in a shelter can compromise health and well-being. And when it becomes long-term confinement, animals can frequently suffer from chronic anxiety, social isolation, inadequate mental stimulation, and lack of physical exercise. And that doesn't mean that these are all inevitable. These are one of the many reasons that we want to stay within our capacity for care so we can make sure that we're providing for their behavioral needs. And so for long-term shelter stays, being able to provide appropriate levels of additional enrichment above and beyond what you would normally doing, alternatives to traditional housing, really becomes critical. Okay. So how do you plan for what your needs will be when some of you are probably on it's the end of July. So some of you may have just finished budgeting if you're on like a July to July fiscal year. Some of you are probably getting ready to gear up for planning and budgeting for 2018 if you run on a calendar year. So when you think about what your needs are going to be and how you're going to allocate resources, how do you do that? I'm sorry, I didn't hear that. Look at our data. Look at our history. Right, because if we don't look back, if we don't have anything to base it on, it's hard to make guesses that are likely to be really accurate. And so one of the things that is so helpful about understanding what your capacity for care is, what your shelter population is, what your staffing levels are, is so that you can plan for what your needs will be and how you can potentially align those if you have, a difference in required number of hours and the number of hours available, or number of enclosures you would really like to see and the ones that you actually have. So when we talk about effective population management, what we're really talking about is minimizing the time that an animal spends in the shelter by moving them through as quickly as possible. And a lot of that comes from making timely decisions and acting on them and reducing bottlenecks. We're not talking about changing the final disposition of an animal. We're not talking about automatically increasing euthanasia. And in reality, this almost always allows us to decrease euthanasia because we can keep the animals happier and healthier, and we can provide care for a greater number of them. Even if we couldn't provide a greater number of them, let's just say, fine, it'll be the same. Why bother if the outcome is the same? I said this doesn't involve changing outcome. Well, I think we would all agree that shorter shelter stays are more humane for pets entering our facilities. Does anybody, would you rather keep an animal in your shelter if you could send them home to an adoptive home? No, because as nice as we try to make it, it is not the same as being in a home. Even foster is generally not the same as being in a home. If you're a foster cat in my house, you get the spare bathroom, and you get an hour, maybe 2 hours of my time a day, depending on what else is going on. That's not the same as my cats who are sleeping on my pillow and, you know, hanging out with us on the couch and everything else. And so the reality is, again, it's not meant to be a criticism, but we are not the environment that we want to keep animals in long term, no matter how good of a job we do and no matter how nice our facilities are. Minimizing the time in shelter, like we talked about, helps to keep the population at a manageable level. So your staff are less stressed, they're better able to care for the animals, rates of infectious disease often go down, animal stress is decreased, welfare is improved. And the animals really are happier and healthier during the time in the shelter, regardless of what that outcome looks like. And the reality is the outcome often isn't the same. Because we can do more for the animals in our care, we can provide better care for them, and we can help more animals as a result, we're often able to help that many more and to save that many more. So effective population management can actually increase live releases and decrease euthanasia in the vast majority. I would say in every situation when it is done thoughtfully and appropriately. So to be forewarned is to be forearmed, right? Thinking about when you look back at data, when you look back at historical records, having that information really lets you look at that, look at what programs you have in place, and think about what do you want to consider adding or changing or tweaking for 18, for 19, moving forward. And again, it doesn't have to be that everything all of a sudden a giant suitcase of money falls out of the sky and you get a new building and 1,000 volunteers and you know it's like your dream come true. If that happens to you, I am very, very happy for you. But the reality is we're working with incremental change, and that is still really important. I don't know how many of you were at the keynote last night, but Dr. Lockwood was saying that when he first started giving lectures on the topics, he was talking about how many states had felony anti-cruelty laws, and we just hit 50 a couple of years ago. So it was literally the difference of going from a handful to 50, and that was incremental change along the way. And sometimes it is easy to overlook incremental change when we think there's so much that we want to do and there's so much work to get there. But the reality is that's how we get where we're going and how we make improvement. So thinking about things that you might be able to change, maybe you want to consider managed intake if you're not doing that already. Do you have or could you strengthen programs that provide alternatives to shelter admittance? Can you provide resources so that pets might be able to keep their people, so that people might be able to keep their pets in their home. Maybe they have an acute medical issue and they need assistance with funding for veterinary care, or they need some training and the assistance of a behaviorist. What could you do to strengthen that, to reduce the need in the shelter? What opportunities do you have to be more efficient, to reduce length of stay in your facility? Can you expand placement options? Can you secure more foster homes or identify more off-site locations? Can you start or expand a foster program or a volunteer program? And then what else is there that you might want to think about making incremental improvements to? Maybe housing, handling, stress reduction, your intake processes, vaccination protocols, sanitation protocols, disease management, staff training, any of those on the list. So I'm going to put this slide up as the okay, now what? And we're going to stop there, take the break, and then we're going to pick up with the what do you actually do with this when we come back after the break. But what we're going to go into next, now that we have that perspective and that understanding, and hopefully you are really sold on why this is so critical, because knowing length of stay in your average shelter population and your resources is going to help you with planning and decision making. So how you allocate resources, how you're utilizing staffing, what your cage space is, and program development. And we're going to talk a bit more about the how-to and the so what after the break.